That's a study which is, the name is ASTER 70s, and it addresses the added value of chemotherapy in addition to endocrine treatment for early breast cancer. And the main goal is to try to better select those women with standard and the most frequent form of breast cancer who really deserve chemotherapy based on a genomic tool. So that's a trial which uses a genomic tool, a modern tool, to better select, and which really tries to organize the indication of chemotherapy. We know that the most important group of women, elderly women, who have this phenotype, ER positive and HER2 negative disease. And among them, most of them derive a great benefit of endocrine treatment, but some of them may derive a higher benefit from chemotherapy in addition. Hopefully, with this type of trial, we'll be able to select better our patients later. We use a genomic grade, which is a different way to assess the histological grade, but on paraffin with a selection of genes. And only those with a high genomic grade are going to be randomized between both therapies, with or without chemo. And actually, it addresses the question of competing risk for mortality, because we know that there is an increased incidence of comorbidity according to age, in severity and in incidence, and that competes with the cancer prognosis. And that it's very important to prioritize the health status, what we treat when we care about these elderly women with breast cancer. So far, only chemotherapy by itself, because chemotherapy is really something which is not very specific in terms of action. That's not at all the case with the new biologicals that we develop. So it's the philosophy of the trial. First point is that it's a program which is flying very well. 2,000 women to be screened for genomic grade. Of them, 800 will be randomized. We've almost completed the program in less than 2 years. So that's a great information. We can run such a very large trial in the elderly population. And the second point is that we really need to be more, to have different endpoints in these trials. And in this endpoint, we combine geriatric items and quality of life, all these items which are so important to the elderly populations as the functional status, to maintain independence.